We breathe without thinking, about 20,000 times a day. Yet most of us have never considered that this automatic act could be trained, strengthened, and optimized in ways that profoundly affect not just our lungs, but our heart, our blood pressure, our metabolism, and even our brain. My guest today is Dr. Lawrence Cahalin, a clinical professor in the Department of Physical Therapy at my alma mater, the University of Miami Miller School of Medicine, a board-certified cardiopulmonary clinical specialist, and a fellow of both the American Physical Therapy Association and the American Heart Association. Dr. Cahalin holds a PhD in gerontology from the University of Massachusetts, Boston, and his research focuses on exercise testing and training, functional capacity assessment, and respiratory muscle training. His work bridges the field of cardiopulmonary rehabilitation and aging, exploring how breath training can improve outcomes for everyone from children with congenital heart disease to older adults with heart failure. In this conversation, we explore the surprising science of respiratory muscle training and its effects on cognition, heart rate variability, blood pressure, and autonomic nervous system function. We discuss why a healthy heart rhythm should actually be slightly irregular, how weak respiratory muscles can steal blood from the legs, and why breath may be one of the most accessible and powerful training tools we have, especially as we age. We also touch on the ancient wisdom embedded in practices like yoga, Pilates, and Qigong that modern research is only now beginning to validate. Welcome to the Live Aligned podcast. I'm Dr. Brent, a doctor of physical therapy, professor, founder of Polestar Pilates, and pathokinesiologist. For over 35 years, I've been fascinated by the dynamic relationship between movement and pathology. On this podcast, I'll host special guests and friends who are making meaningful contributions to help us live aligned and be kind. Breath is a tool, not a rule. At Polestar Pilates, students learn how to empower breath to optimize performance and health. Learning and applying these simple yet powerful tools into your existing movement practice can seriously change your game. Looking to optimize your health? Find a Polestar Pilates graduate near you. Go to the Polestar Pilates website, click on Find Your Graduate, and search for a professional in your area. If you're ready to begin your own training, go to the Polestar Pilates website, choose your course, and use the code Dr. Brent. The code is DRBRENT to receive 10% off your tuition. And now, my conversation with my colleague and dear friend, Dr. Larry Cahalin. Larry, it's fantastic to have you on the Live Aligned podcast. Thank you for joining us today. I know how busy you are. I know that your life runs in circles. We meet in random places. We met in Kansas City at a physical therapy conference, and it was like, I got you. Let's lock you down. I want you on my podcast. So thank you.
That was fun.
Your latest research, I saw that you did a systematic review looking at respiratory muscle training and looking at its effect on cognition and cognitive performance. Look, breath is probably one of the most powerful ancient tools, and you're leading on the evidence-based side of it now of things that we've talked about in yoga, in Pilates, in Qigong, all these different breath forms that we're seeing the effect of. So tell us a little bit about what you're up to these days.
Yeah, well, thank you. I think you're right. When we just think about breathing, it's so essential for life. It allows us to, have adequate metabolic activity take place, and it allows us to then remove carbon dioxide that might be building up. And, we forget some of the other aspects of breathing that allow so many other physiologic phenomenon to occur. And, one of the things we mentioned briefly before starting this was just the effect that breathing can have upon the autonomic nervous system. And, if we were to do an experiment right now, I could ask you, if you wanted to take your pulse, and hopefully you can identify your pulse. You can find it, and hopefully it's regular. And I would ask you to just focus on the regularity of the pulse, and then ask you to take several deep breaths. And as you take those deep breaths, I'd like you to tell me what you might feel in terms of the pulse and the regularity. So I'm going to do the same thing with you, if you don't mind.
Yeah.
And just one more. And what typically should be felt in the pulse is a more irregular pulse, which doesn't make a whole lot of sense, but it is that irregularity that allows us to see that breathing can influence the autonomic nervous system and produce what we call a sinus arrhythmia. So the rhythm becomes a little bit more irregular because of heart rate variability. And that heart rate variability really is a sign of good health and of good prognosis for individuals. So it's a simple test that we sometimes will use when we're concerned about a person, maybe their risk factors, maybe problems that they might have with too much activity, stress, anxiety. And if they cannot alter their rhythm, the heart rhythm, the pulse, there's an indication that they may be overstressed. They may have, more of a chronic disease or a need to maybe improve their breathing and exercise and maybe reduce risk factors that would hopefully allow them to have more of that, what we call again, a sinus arrhythmia, which is really a sign of good health when we see the rhythm in the heart rate and the pulse changing as a result of breathing. And I hope that
That's
related.
really interesting, Larry, because I've dealt with some cardiac health issues that work through, and I've always used breath to like try to slow down my heart rate, not so much heart rate, but more like control blood pressure.
Yeah.
And I feel that arrhythmia, and it freaked me out because I was thinking like, oh, maybe I have, I'm having an episode as well, like going out of sinus. But actually, that's really encouraging to know that that's part of the health aspect. Now, I know I've used breath and box breathing and things like that to be able to calm stress down, to be able to, decrease and I've seen it like going from, 135 over 90 to 120 over 80 in a matter of 5 minutes of doing box breathing, and realizing that it's just living in a stressful situation or just where my lifestyle has created a new norm almost. And then I go out of norm by slowing down and concentrating on breath. One of my questions was, does the mechanics of the breath, like the actual movement of or the pressure change in the chest cavity, does that facilitate any of the healthy arrhythmia that you're talking about?
Yeah, it's a great question. I think, in general, as you know, and as we've talked, and I, again, thank you for allowing me to do this today, but also to speak at the Polestar meeting years ago. And that was a lot of fun. But I think when we breathe, as you know, the diaphragm will move from a position at end exhalation, and it will descend into a shortened contracted position, and then hopefully again rise up to an end exhalation position. And that movement as the diaphragm descends now makes the thoracic cavity, the intrathoracic area, larger. And as that area becomes larger, the pressure within it decreases. So air in the atmosphere sees that low pressure system and says, oh, baby, a low pressure system, that's where I'm going. And the lungs fill with air. And then passively, air should then be exhaled from a person. So that same mechanical aspect, of a decreased intrathoracic pressure, now allowing air to fill the lungs, also allows for blood at the superior and inferior vena cava to now fill the cardiac chambers more during inhalation. And then during exhalation, it'll alter that and maybe decrease the filling a little bit more. So the mechanical aspects, I think, not only affect the autonomic nervous system, but I think it also affects the
The
way by which
mechanics.
the heart fills, contracts, and then, can benefit a person in many ways, as you mentioned.
I think that's really important for people to understand. We often think of And you and I have talked about this, and I even drew a picture once of a gorilla inside the rib cage that we think of it as being something that doesn't move and we don't want it to move, where it's quite the opposite. It protects us, it protects our vital organs, but there should be a lot of movement in it. And that movement is what allows that change in pressure for like a vacuum feeling for the lungs to fill up with air, and then a compression feeling for them to empty.
Yep.
And I guess sometimes we don't think about the heart as well as the lungs being affected by the pressure inside the chest cavity, right?
Yeah.
Which we call the thoracic. So it's like the rib cage, the spine, what holds the lungs and the heart. And one of the things I was trying to do for a while, Larry, and probably off of your lecture, was teaching a movement class, a Pilates class, based on the circulatory system, and sort of thinking of all the exercises we do, but sort of identifying how the movement of a roll-up or going into an extended swan or going into side bending would impact the movement of the rib cage, the thoracic cavity,
Yeah.
and how that might change things like where the lung expands or how it moves around the pericardium or the heart when you're doing rotation and those kind of things. And it really is a refreshing, and the feedback I get from it is it's so refreshing to think of movement around the organs or around the circulatory system.
Yeah, it's a really good point, Brent. And I think, when we think about those movements, and hopefully there is sufficient movement within the thoracic cavity, there are so many numerous receptors that are stimulated that, again, can facilitate not just the breath, but the motion, the movement of the thorax. And as you said, we know that body position with Pilates and with any type of exercise will alter the cardiovascular response and allow for those receptors to be stimulated and really produce more favorable movement and hopefully more favorable physiology throughout the body.
One of the things that often comes up, and I would love to get your thoughts on it, is the idea of breathing, let's say, types or strategies is a better word, breath strategies. Like if your primary strategy is a chest breath or an accessory breath, breathing up in the neck, or a good diaphragmatic expansion or just a belly breath, do you feel that the strategy, because a lot of times we'll say, oh, we're going to work on a vagal technique, the vagus nerve, and we're going to work on decreasing stress. And we have people breathing, but we don't realize that maybe the strategy that they're breathing with isn't as effective at actually moving those receptors that you're talking about in the thoracic or the rib cage area around the heart and the lungs.
Yeah. No, it's a really good point. And I think, overall, what you would like to do is for each person that you're working with, whether it's a client who's healthy and they just want to improve their movement performance, whatever it is they're trying to do, maybe they're a singer and they need to improve their breath to sing better and to, maybe play an instrument a little better based upon what they are able to do or not do with their breath. But I think overall, when we think about those particular types of breathing techniques, it really should be individualized. And we do know, however, that if we can improve the strength, endurance, and power of the respiratory muscles, there are so many physiologic factors that can be improved upon. There's been a lot of really nice work out of the University of Colorado at Boulder by a team of scientists led by a guy named Doug Seals. And he's done some beautiful work over the past several years with a number of his PhD students. And they've been looking at the effects of breathing, and I would say it's high intensity inspiratory muscle training at about 60 to 80% of the individual's maximal capacity. And they found, as you sort of suggested, that there are improvements in blood pressure, endothelial function, nitric oxide bioavailability, oxidative stress, cerebrovascular reactivity, and mitochondrial oxidative metabolism that are really just from breathing exercises done probably 20 to 30 minutes a day and at a high intensity. And it probably doesn't even have to be done daily. It probably could be done every other day. And you can have these improvements, as you suggested, in terms of blood pressure and the mechanisms that are improving blood pressure as well as cognition. And, that's something that, as you know, I've been looking at with some of my colleagues here at the University of Miami.
Yeah, and it's not just the blood pressure, but as you say, it's metabolic, it's mitochondria, which are in the cells, which allow cells to do their function, whatever they're designed to do. The mitochondria is like, we see that more and more as like, how do we get mitochondria activity to improve our health, whether it's cognition, muscle performance, digestion, any of our normal functions. One of the things I always find, and I usually make a joke about it, but I'll have a patient come in and they'll say, Dr. Anderson, I'm a really bad breather. And, I'll look at them and then I'll look at their fingernails and I'll touch their face and look at their skin. I said, well, you look like a pretty good breather to me, because most of the bad breathers I know are dead. But the point that I make is that we can always expand our breath training capacity, because a lot of people come in and they're told things by us, like their posture is bad, their scoliosis is going to kill them, their respiratory rate's too bad. And how do we take the fear out of it, but at the same time say, now, this is where we can go. This is where you can improve and even get better function and better possibilities.
No, it's a really good point. And, I'm lucky to have so many really good PhD students working with me here at the university. And I have one, you mentioned the systematic review, who has been really interested in looking at children with congenital heart disease and providing them with breathing techniques that will hopefully facilitate not just, their autonomic nervous system, but their overall health, improve maybe even some of the manifestations of their congenital heart disease, and as well improve their cognition. And that student did a great job. I have another student looking at low back pain and its influence on breathing, or just the way that a person with low back pain breathes and how we might be able to improve their breath, but also improve their low back pain. I have others who are looking at, like we had talked about earlier, individuals who have COPD or heart failure and the effects it has on a person. We did a really nice presentation earlier this year in Atlanta at the American College of Sports Medicine meeting on some of the research we'd done with patients who have heart failure. And we, for the most part, we have the first paper looking at the metabolic effects, the metabolism, something called metabolomics. And we can actually identify that when a person does respiratory muscle training, inspiratory muscle training mostly, they can improve their oxidative metabolism and therefore maybe even burn more fat and just have a better overall physiology. And, and it was done probably on a daily basis for about 8 to 12 weeks. And I think this kind of thing in terms of breathing can help in so many different ways. And I think sometimes we overlook the importance of really optimizing breath.
You might be giving GLP-1 a big run for their money.
You know what? You might be right.
Which would be great.
Yeah.
Which would be great. Let's talk a little bit about that, Larry, as far as the respiratory muscle training. What does that mean? What does that look like? I think this is so important to me, because any time that we can get our subconscious physiology to do its job right, everything is better.
Yeah.
And most people don't have an awareness of that, because it sneaks up on us so gradually that all of a sudden we have blood pressure issues. All of a sudden we have, some difficulty metabolizing different chemicals in our body that we need to be metabolizing, or cleaning and filtering, a little bit of pressure change. I love teaching the renal system in pathology, because to me it's like, do you realize how crucial that is for everything from your blood pressure to your filtering to removing toxicity, and it's something that we don't talk about very much in, how we pee and how we can eliminate some of the toxicities in our body, and how we regulate blood pressure and how we regulate salt in our body and those kind of things, how we metabolize it. So I'm curious today of really looking at, what do you mean when you say respiratory muscle training? What would that look like? Is there some samples of it that we could share with the audience today, of just something that generically is going to be healthier for them, and maybe how they could find somebody as well? Because I think of this as people that are dealing with musculoskeletal dysfunctions and at the same time aging dysfunctions of cardiopulmonary, kidney dysfunction, weight gain. How can we use breath training to be able to possibly put them in a better state than they are right now, even if their knees aren't allowing them to get out and just go for a walk? Like, how could they do something while they're sitting in their home?
Yeah, no, it's a really good point. I think there are so many different ways that a person can do it. And I think, the example we started with, just in terms of taking several deep breaths to perhaps just improve the movement within the thorax, but also to improve the aeration of the lungs, to maybe bring a little bit more oxygen in and maybe a little bit less carbon dioxide to, or I should say more carbon dioxide to be exhaled, can certainly improve the system. But besides, diaphragmatic breathing and working with other breathing techniques, a lot of people over the past 20 or 30 years now have been using different devices that are oftentimes spring-loaded. They're little pieces of plastic typically that have a spring within it, and the spring pushes against an orifice that when you inspire, that orifice comes towards the mouth. The person has a resistance then set by that spring, and you actually have a bit of work now imposed upon the inspiratory or expiratory muscles that hopefully can improve the strength, that can improve the endurance and power, and allow the person to then have a greater maximal inspiratory pressure, a greater maximal expiratory pressure, that then, let's just say they do have obstructive lung disease and they are very weak and they can't really walk. One reason they can't walk is it might be the respiratory muscles are so weak and they can't breathe properly. And when they aren't breathing properly, the respiratory muscles, they need to continue to breathe. It's something we take for granted. But what will happen in the person with weak respiratory muscles is something called the respiratory metabolic reflex. And that reflex is due to weak respiratory muscles that are fatigued. They now need to continue to breathe. And so what happens is, to continue breathing and provide metabolic activity to the respiratory muscles, blood is stolen from the periphery and brought to the respiratory muscles. And now the person has less blood flow to the legs. They can't walk because their respiratory muscles are so weak. And so numerous studies have found if you can strengthen the respiratory muscles, there's less blood stolen from the periphery and the person can walk better. They have less shortness of breath. And it's the respiratory muscle training that I had mentioned where they do it maybe every day or every other day at a moderate to a high intensity. And they're very likely to improve strength, endurance, power, and just have better comfort when breathing.
Yeah. I really like that idea. And I think that's an easy way to teach it too. It's just, if your respiratory muscles, when we talk about respiratory muscles, the main one is the diaphragm. And then we have a lot of our abdominal intercostal muscles that aid and assist in that. A lot of it too, movement creates respiratory change, as we mentioned, that could give a break maybe to those fatigued muscles by just changing position a little bit. But it makes so much sense that there's a prioritization list in the body's homeostasis, right? So it's going to, breathing and heartbeat and brain are going to prioritize every muscle activity that there is. The blood's going to go there first. The oxygen's going to go there first, which means other parts of our body would fail or fatigue. And we see that in, sepsis. We see people in chronic disease where, we know when their kidneys and liver start to fail that it's not far from them having fatality if we can't get that reversed. And so maybe in that mindset, thinking of, how good is it that we focus on breath exercise training first when we're coming back, even from musculoskeletal injuries? You think if you've been down for 2 months post-surgery of a total knee replacement or a back surgery or something like that, that breath work you can be doing right away.
Absolutely.
For the most part, unless you're, cut into the thoracic cage or something like that. So cardio rehab. But, it's like that to me is really a take-home message today already, is doing that. Now, you talked about, is it like the respirometer or those kind of things? Like I had surgery, I had to suck into a thing. Is it different than that, or is it more like what I see people doing on the treadmill when they're training for high altitude or
Yeah, it's a great question. It's not like the devices that you might be given in a hospital where you maybe have a ball and you want to inspire and bring the ball up to a certain level or some device up to a certain level, because there's no real work placed upon the respiratory
Right.
muscles. But they're called threshold devices for the most part, and there's a spring, as I mentioned earlier, that's inside of this little plastic case. You can wind the spring tighter or less tight, and then, as I
So
mentioned,
you
the spring
adjust
is
the resistance in the
exactly.
inhalation.
Yeah. But there are other devices. We just did a study with individuals who were on hospice with severe heart failure for the most part, and we use this device. It's called the Pro 2. It's something that you can use from a person's home, and all the data from their inspiratory or expiratory training is sent to the cloud. We can interrogate it real time or sometime after they've done the training. Provides us with a nice training platform, and that training platform, is not using the spring-loaded resistance that I mentioned. It's using, for the most part, a small 2 millimeter diameter hole within the mouthpiece that then you can
Creates the
generate pressure,
resistance.
and the more you generate, the greater the workload will be for the training. And so there's this type of device. There's the Power Breathe device. The Power Breathe, there are numerous spring-loaded devices and devices very similar to this one that I just showed to you. So
And
there's a
is there any contraindication for somebody looking up and buying a power breathe device or a threshold device to train with? Is there like enough YouTube videos out there and instruction that somebody could relatively safely engage in respiratory muscle training?
Yeah, absolutely. I really think that there are no substantial contraindications. I mean, you mentioned maybe after a thoracic surgery that might be a
Right,
problem. But
right.
if we actually splint the area where they've had the surgery, provide them with a pillow, they need to breathe, and to complete a full inhalation is really necessary to, better aerate the lungs. So I think there really should be no contraindications.
And these are all home devices, right? These are things that
Yeah,
patients could take with them and or clients
absolutely.
could find and they could do. People that want to run better, people that want to have
Yeah.
better endurance.
Yeah, and there's good literature showing that even athletes, if they do this type of training, they actually can improve their respiratory muscle performance. They then maybe will have other subsequent effects: improved running, improved sport performance. We did a study with ice hockey players back in Boston, and we were able to improve their skating. And one of the things that I now I see it makes sense is that when we were training these ice hockey players, they said that they could see and think more clearly when they were on the ice playing. And I think it's all because of that respiratory metabolic reflex being improved that I mentioned. But also, when we think about breathing and the pressure gradient changes and the brain, when we inhale, we create a negative pressure, and that negative pressure is felt throughout the body. And what studies have shown is that when the person inhales, that negative pressure draws more blood out of the brain, the venous flow increases. And when we exhale, the blood goes to the brain, the
Hmm.
arterial inflow increases. And there have been some beautiful studies showing just that. And what we've been trying to do now is look at people who are older who maybe have subjective cognitive complaints. And we found substantial, significant correlations with respiratory muscle performance and 3 different cognitive tests. The MoCA is one. We've also used a pretty sophisticated computer-driven cognitive test called the NeuroTrax, and
Oh, I've seen that.
another one which we've used is the R bands. And with each one of those, we've noticed in people who are healthy and people with subjective cognitive complaints, there are significant correlations between respiratory muscle performance and these 3 methods
Oh,
of
this is
looking at
great.
cognition. And I think it makes sense when we think about breathing, the ice hockey players feeling like they could think and see more clearly and score more goals. Athletes, people who are sick, whether it's cognitive decline, a cardiac or a pulmonary condition, I think, the breathing will hopefully make these pressure gradient changes if they can breathe and breathe on their own. And that will hopefully improve not just the physiology of the respiratory muscles, but so many other physiological phenomena throughout the body.
That's awesome. And just to, put it another step so I know I understand it correctly, is when you create the demand for the venous return, you're basically creating the demand for oxygenated blood to go into those tissues. And so it's the oxygenated tissue blood going into those tissues that's going to heighten awareness and function. And that's true with all tissue in the body.
Yeah.
We know that Joseph Pilates, funny enough, talked about it as the internal shower. He would talk about this. This is in the 40s, Larry, where he would say, you need to have a vigorous exercise because the blood needs to scrub out and clean your body and bring new oxygen to every cell of your body from your toes to your scalp, Well, he was right on the money. Yeah.
No, in fact, I remember you provided me with a video of him doing a clock type exercise with breathing.
Mm-hmm.
What was that called? I can't remember.
I have to look it up. It's in his Return to Life book.
Okay.
That he has the picture of him doing that. He had a different exercise on each of the 12 numbers.
Yeah.
That was his. And what it did, and goes back to where I think some of the genius is just intuitively, was you're rolling and moving the body in different planes against different orientations to gravity.
Yeah.
So if you're thinking of like having movement and load in the legs and in the arms and the trunk and the side bending and rotation and flexion and extension all around the trunk, in each of these with breath combined to that, right?
Exactly.
That you're going to clean the body out. You're going to get this cleansing, this internal shower that he talked about. And he also talked about, complete exhalation a number of times a day, like really to just, after you're done exercising, really push that old air out and, bring the new air in and oxygenate all your tissues while the blood's pumping.
Yeah.
So, that's back in the 40s.
And I remember it. No, and I think it was interesting to see the way he actually did that in the video and the workload, like you said, that was imposed upon the respiratory, the cardiovascular, and the neuromuscular system in those positions, as well as the breath work that accompanied it. So it was pretty cool. But it's so important, I think, when we think about, for me, the importance of venous return and how it can be very helpful in so many cases. But in some cases, if a person does have let's just say a heart that's, dilated and the end diastolic pressures are markedly elevated, the breath might be a little bit of a problem. One of the first studies we did back in Boston at Mass General Hospital was in patients awaiting for cardiac transplantation. And we found that there were some individuals who had really dilated hearts with a lot of blood within the ventricle. When they did extreme or higher intensity inspiratory muscle training, it caused them to have poorer cardiovascular function. So I think maybe in terms of a contraindication would be, high intensity inspiratory training in a person with, severe heart failure might be a concern, and maybe a person should see someone with that type of condition.
Yeah, I would say definitely, if you have heart disease, you would ask your cardiologist if there was any contraindication with you doing resistive, respiratory muscular training. I'm going to go buy mine today. I'm going to go look for it and order one.
Perfect.
I'm going to say the name wrong. You'll correct me. But what's the new breathing technique? Everybody's something Hof or
Wim Hof breathing.
Yeah, that about, and how is that being respected in the literature? I certainly see it a lot amongst people that are, in the Pilates world, in the complementary therapies world, the yoga world, the ice baths, those kind of things.
Yeah.
What are we looking at here?
Yeah, it's a great question. We've actually researched it a fair amount with my DPT and PhD students. It's interesting in the way that it's performed. You have a moderate degree of hyperinflation that occurs, and then you have breath holding. And as the person progresses through the series of breathing exercises, the hyperventilation continues to increase, and the breath hold, that duration increases as well. So what you're essentially trying to elicit would be more of a hypoxic environment, in which we know if it's intermittent hypoxia, there are so many benefits to that. There are actually people who provide individuals with masks, and they provide a lower level of oxygen. Room air has 21% oxygen, and they might give the person 12 to 15% oxygen, 1 minute on, 1 minute off. And we know that can elicit greater breathing strength and endurance because there's that hypoxic period that the respiratory
Trying to
center.
make up.
Yeah,
Yeah.
exactly. Yeah. But it also seems to elicit more of what we've observed is an improvement in the autonomic nervous system. And the other factors that seem to improve would be, there's an improvement very likely in brain-derived neurotrophic factor, BDNF, as well as vascular endothelial growth factor, which is abbreviated as VEGF. So these intermittent hypoxic episodes have the potential to improve the brain function with BDNF, vascular endothelial growth factor, VEGF. And I think these types of breathing techniques can be somewhat beneficial. But when you look at the literature in athletes, and there hasn't been a lot in different patient populations, but you don't see a whole lot of effect. We looked at different functional tasks in individuals who were, for the most part, college students and a little bit older population, maybe in their 30s and 40s, and we didn't see a whole lot improving. But it's not to say that, during the acute bouts, we saw that there were changes, certainly, in their heart rate, in their blood pressure, and in their what you would call the end-tidal carbon dioxide, end-tidal CO2. So these things do change dramatically during this type of breathing, and over the long term may have the effects that I just mentioned. And I hope that makes sense.
It does. And just to put it simple, is like when you create the hypoxia being, hypo means too little, right?
Yeah.
Hyper means more, too much. So hypoxia, as you said, going from a normal 21, 22% oxygen mixture of the air down to 12, 13% is going to create a deficiency of oxygen in your blood system, and it's going to demand a change in the neurochemistry, the blood chemistry of the body. One of the big things I always see with these kind of techniques is we don't ask the right questions necessarily. It's like, or the right population, as you've mentioned. And, I remember, we felt going back into part of the research study we did with the Pilates and chronic low back pain. We kept looking to see physical limitation outcome measures be predictive of functional outcome. And there just wasn't, it was 50%, 48%, 52%. It was a toss of a coin.
Yeah.
But we then took the psychosocial outcome measures, and we realized that they became incredibly predictive, up as high as 82% with the self-efficacy.
Yeah.
But the reason why I bring this up is that in the behavioral psychology literature, they showed that those particular scales were incredibly predictive, but they couldn't influence them or change them. So it's basically, what neurologists say, diagnose adios kind of thing. Like, you're never going to get better.
Yeah.
You've got a really low self-efficacy score, or you're going to get better no matter what.
Right.
And what we found was that by having the successful movement experiences, we actually did shift the psychosocial behavioral skills that led to the consistency of movement that did change all the physical limitations. They just weren't predictive.
I understand.
So I think as physical therapists and trainers, we were creating the changes if we had a way of creating these positive movement experiences.
Yeah.
And a lot of us do. We're very skilled at meeting our patient where they are, creating a positive movement experiences, pushing them just enough that they're seeing the benefits of it. They believe they're going to get better. Then we're going to see the physiology follow with the consistency of the program. And the behavioral psychology wasn't doing anything that was physiological.
Right.
It was just like, close your eyes, imagine lifting that box without back pain. Well, that didn't do anything for them.
Yeah.
And I think when we look at other things like this, where, this is what's so interesting to me, is that you're seeing cognitive performance changes by doing something as basic as respiratory muscle training.
Yeah.
And to me, this is like a real light bulb going off because, again, in Pilates, gyotonic, yoga, Tai Chi, Qigong, all of these have breath techniques built into them, right?
Yeah.
And have from thousands of years ago for the ancient ones. Right. And realizing that there are these incredible effects that just having clarity of thought is more likely to lead you to do exercises or activities that are going to be healthier for you, to eat healthier, to sleep better, right? And all these
Yeah,
things that we know physiologically are crucial to quality of life measures.
for
And
sure.
yet you're discovering with many of the other scientists right now, and this is why I think this was so curious and interesting to me, is how can we do a better job not only of teaching breath, because I think we do a pretty good job of teaching breath, and I think we can add things that have more of a resistive, whether there's things we could do with pursed lips or those kind of
Hmm.
things that
Yeah,
could increase the resistance,
right.
or like we would do in yoga, closing the nostril.
Yeah,
It's us understanding enough to be able to teach our client why it's so important for them to continue not only doing the movement,
right.
but focusing on the breathing techniques of that movement that are probably going to give them that more positive cognitive clarity that just improves every aspect of their life. This is huge.
No, you're right. And I think, the point you're bringing up is something that you just given me another idea to research. And it brings me back to my PhD, which focused on some of the work that Albert Bandura did in terms of self-efficacy. And that's what you
That
were talking
was
about.
that was my
And
man.
yeah, and when thinking about that, I think there is a very likely an improvement in self-efficacy in a person with disease or without, if they actually can breathe more comfortably and with less stress or anxiety or discomfort. It's very likely they're going to have greater self-efficacy to do their functional activities of daily living, whatever it is they need to do and want to
Yeah.
do. But I think it's something that really, I'm not even sure if there's much research on that. I'd have to take a look and
There's our next study.
yeah, exactly, exactly. But I think it's really an important thing to think about, as you mentioned. And I think, one other thing I wanted to mention just before, I don't know how much longer we're going to be on. I have a couple more hours if you want.
You and I could go for a long time.
We could. But, you were asking about different devices. During COVID, what I used, because we couldn't use these types of things again and again with other subjects or patients. So what we would do is I would ask people to purchase a cheap sphygmomanometer, and they would cut the tubing from the sphygmomanometer, attach it to a mouthpiece if they could, and that would allow them to inspire or exhale against the sphygmomanometer, which we would normally use to take blood pressure. And that actually, as when we've studied this, when you inspire, the needle moves backwards and you can actually measure a person's maximal pressure and then have them work at maybe 50% of their maximal pressure to inhale or exhale when the needle goes in a regular direction, the positive direction, like when we're taking blood pressure. And I hope that makes sense.
So as the blood pressure cuff is a sphygmometer, and you basically cut the cuff side off
Yep. Yeah.
and put a mouthpiece on the hose
Yep.
that goes into the actual measurement of the pressure.
Exactly.
Very
And
interesting.
it's something that we did a lot. I did a podcast on it for the APTA, and I think there were people around the world who were doing this because they didn't have either the opportunity to get devices like this, and you can sometimes purchase a sphygmomanometer for $7 to $10, and then the
Mm-hmm.
mouthpiece. I on the podcast identified a couple companies that sold these mouthpieces for maybe $2 or $3, so they could actually have an expiratory muscle
$12,
training device.
$15. Yeah.
Yeah. So,
There were a couple other things that sort of came up besides the cognitive gains when I was just doing my own little research and
yeah,
looking at things like entrainment and oscillation is something that came up with the neural link.
yeah,
Are you familiar with that at all?
I am. Yeah.
What I'm not sure I understand like this synchronization or oscillation that is talking about with the nervous system.
Yeah, it's a great question. We actually, one of my PhD students, a really smart guy, was the person who introduced me to this. And we subsequently have been meeting with one of the pulmonologists here and one of his attendings at University of Miami, looking at something you brought up, what they call fragmented sleep. So a person who might be in the hospital, they don't sleep well. And then what happens to their ability to now use their brain and to then use their nervous system to work together to optimize thought and to optimize physiologic function. And so what you would do is look at EEG recordings, you would then look at the way that a person might be breathing and how that breathing might affect the EEG signal and then the nervous system activity as well. So it's somewhat of a complicated measurement, but I think it gets to that entrainment aspect where we can entrain our breathing, whether we have poor sleep, good sleep, whatever. But I think we can entrain our nervous system to work more effectively and allow a person to maybe have even better brain function as a result of just improving the nervous system as well as the breath.
Interesting. And again, that ties into neuroplasticity as far as those kind of patterns. And I do find it very interesting. And we didn't touch on it today, and we won't have time today, but we can come back and talk a little bit more about a lot of the vagal responses and the vagal training that is happening out there.
Yeah.
The vagal nerve is part of the autonomic nervous system and is on the parasympathetic side, but it's more complex than that. And I would love to get a lesson on some of the new complexities that are coming forward with vagal response and vagal nerve and those kind of things. It's quite a whole science in itself, isn't it? The vagal nerve.
It's so very true. I mean, the vagus nerve, it's entitled the vagus nerve because it travels extensively throughout the thoracic cavity. And, whatever we do, the positions you've talked about with Pilates and or just the breathing effects can significantly affect the vagus nerve, hopefully improve parasympathetic tone, as you mentioned, and allow a person who may be overstimulated or over sympathetic tone
Right.
or have greater sympathetic tone to have just better physiologic performance,
Yeah. Well, Larry, this has been wonderful. And, takeaways today for me, the reinforcement that breath can be a stress reducer for us. Breath can be a stress enhancer for us if we need it to, boost us up a little bit and give us energy. I love the work that you're doing with cognition. I think that this is, to me, probably one of the most powerful ones, especially as I'm entering into this stage of my life. And, it's like our parents have passed, but we watched our parents lose cognition and, as well as other type of neurological diseases like Alzheimer's and dementia, and thinking of how we can continue the conditioning. We always talk about conditioning our muscles. We're conditioning our nervous system. We're conditioning our, all of our organ functions and really making a difference in improving the quality of life while we live. The other thing that sort of came to my mind was just that it's so accessible to be able to do respiratory muscle training. So I'm sort of looking forward to seeing, more and more programs that are incorporating it. Just, for me, just to see somebody sitting at a desk and, taking a 15-minute break and doing, 15 minutes of, RMT and being able to, have that benefit their life, and, or that they know that in the gym, there are going to be classes now that happen, every day. You could go in and have an RMT class tied into it. So I'm sure we're going to see that, especially as the research comes out more conclusive of cognitive function. And I also, I'm always interested in looking at, ancient practices that we borrow from to be able to see the applications that exist inside of these type of areas. And I think we're just going to keep seeing more and more clarity on this and realize that maybe the whole time it was just, doing something that, forced you to breathe a little more vigorously and clean yourself out and, have that mental clarity. So what an important part of our life. We think of Maslow's hierarchy of needs. And you can take a lot of things away for a long time and we can survive, but breath just isn't one of them.
That's a good point. Yeah.
It's just such a crucial part of it. So I think of Joseph, I'll finish with sort of one of Joseph Pilates' formulas for health and happiness was lots of movement. It was good nutrition, good sleep hygiene. It was what he would call hygiene. And hygiene would be anything from scrubbing the outside of your body to cleansing the inside of your body with the internal shower. Fresh air and sunshine. So you think of Huberman's work now talking about making sure we get some sunshine early in the morning. And then it was a management of our stresses of work, relaxation, and recreation. And that we need to play. right?
Yeah.
And so you think of something that was so basic, and again, if you go back, I'm sure, into Chinese Confucianism, or you go back into native indigenous practices, I think we'll see a lot of the same things that are part of that.
Yeah.
So appreciate your time, Larry.
Thank you, Brent. It's been a pleasure chatting with you and being a part of this today. Appreciate it.
Thank you for joining the Live Aligned podcast. If you like what you hear, please let us know by leaving a review on your favorite platform. If you have comments or questions, please leave me a message at drbrentanderson.com. You can follow me on Instagram at drbrentpt. To take a deeper dive into the science of movement, check out my new book, Principles of Movement, available on Amazon. Live Aligned podcast is produced and edited by Gabe Anderson. Music and sound designed by Delver. Special thanks to my team, Elizabeth Jimenez, Melissa Pereda, Cesar Maya, Gary Bentz, and Charlie Zuckerman. I also want to thank the team at Polestar Pilates for sponsoring and supporting us with technology, marketing, strategy, and much, much more. Thanks again for listening. Live aligned and be kind.